in healthcare as an industry, transparency at every level is extraordinarily important. The major ethical lapses is not being transparent to the patients in terms of your pricing. Somebody who says, I do 10 knee replacements and I see 100 patients, just imagine we are so besieged, with an emotional, sometimes trauma, sometimes, this deep empathy, and sometimes when we miss a diagnosis, the guilt of that could be so overpowering. Behind the mask, caring for the caregiver, which is doctors have to be cared for, doctors have to be treated well, doctors have a life, doctors have. It's very nice, the theme, actually.
Absolutely.
Many times we forget who we are. I did not have much time when my children were growing. And that was the biggest disservice, and which I recommend to people now for a long time, don't ever do that. And I was too engrossed in my profession. I put patients first and family second.
Hello, everyone. Welcome to Beyond the Stethoscope, where we go past the prescriptions and procedures to bring you inspiring conversations with the minds shaping the future of healthcare. For our very first episode, we are thrilled to have a true pioneer with us, Dr. Guru N Reddy, a globally respected gastroenterologist. Dr. Reddy splits his time and practice between Asia and North America, bridging two continents with his expertise and compassion. With over 4.5 lakh patients treated and countless endoscopic procedures under his belt, he's not just a doctor with accolades, he's a man with a mission. Today, we dive into the journey behind the white coat, what drives him, what changes he has seen in medicine over the years, and his bold vision for the future of Indian healthcare. So stay tuned as we go beyond the stethoscope with Dr. Guru N Reddy. So, Dr. Reddy, welcome to the episode. And I would like to start at the very beginning with, what was your childhood like? And was medicine always your calling, or did life nudge you in that direction over time?
First of all, thank you, Kalpana, for doing this. I didn't realize that this is the first episode. Hopefully, I'll do some justice to that. And
Yes,
that's a
sure.
great start. What really inspired me to become a doctor. So my childhood is probably like most other, childhoods of people. I was born in a humble middle class family and went to a private school, fortunately, in the city of Hyderabad. And my father and my mother, my parents were extraordinarily inspiring. And we were five children. I am the oldest of the five children. So going to school, my father had certain expectations and certain demands, and where our performance was extraordinarily important for him. So we had to constantly keep up with the ranks and be the best and be the first and all those things like a typical Indian parent, that we keep hearing about it.
Yeah.
So this was no exception about 50, 60 years ago. So to please father and to please the parents to some extent in those days, then certainly that became or ingrained as a habit in you. And graduating at top of the school and at top in the state, and being receiving a special merit scholarship that facilitated me to pursue my college education and subsequently my medical school education. Okay, so in a nutshell, my school journey, was exciting. Beyond academics, I was fortunate enough to have the ability to do many other things. I was a class leader, I played cricket, and I did elocution contests, debating contests, quiz competitions. I was the Interact Club president, then Rotaract, and all these various activities. That really kind of, if I retrospectively analyze, that made me who am I today? A very wholesome individual, ability to really kind of confront the challenges of life and transforming me to be a better person every day.
You surely made your parents super proud.
I did, I bet. I did. Yes.
So, you built a remarkable career in the US. yet you chose to stay rooted in India. So, what kept you pulling back and what made you really anchored to your nation?
Well, first, my transition to the US was with a singular purpose to be better educated. Okay. And I know when I finished medical school at the time of post graduation, I realized that there were significant limitations. First of all, access to post graduation studies in this country and availability of very broad spectrum specialty. So I made my mind. I finished all the qualifying exams and went to the US and went to one of the best universities and finished my super specialization in gastroenterology, liver disease, and nutrition from one of the famous universities, the largest medical center in the world. And I had a glorious career and established a practice, was in teaching, was in academia, and also there also, I think with help of the Lord and help of all the best well-wishers in my life who are associated with me, I rose to the ranks and beyond the clinician, I took the reins of leadership at a young age of 30, 34, 35 in the US. That was extraordinary, uncommon, and remarkable to many. So while I was treated or acknowledged well in a foreign country, after a certain number of years or decades, India never left me.
Mhm.
As people say that, you can leave India, but Indianness never leaves you. And no matter what it is, because this is our mother country. And to some extent, I think as a doctor, I was very much associated with various social activities before I left India. I was
Mhm.
talking to you about Interact, Protract, and all. Um,
Right.
Most of my weekends were spent in serving people in the rural communities and the various health checks and all of those things. So then I knew what was the status of healthcare in India because every other year I was coming back to India and and visiting with my parents, and obviously as they were aging they had chronic diseases, and although they were very strong, they had access to good doctors. So sometimes I used to volunteer to take them to the doctors. Then I saw the state of affair of the hospitals here, the infrastructure of the hospitals, the large crowds, and the amount of time doctors used to spend, for various reasons, maybe the compulsions and the demands on them, or maybe the way in which this was practiced. So these things started affecting me. I said, listen, no matter how famous I am someplace, how well I've earned, how rich, I can become or I became, what is the value of something when when you have the ability to do something about it? Okay. So what drove me to do something, come back or do something here was precisely the organization, how healthcare was pivoted in India at that point in time, which is talking about not too far away in
Mhm.
the 2000s, in the 21st century. Forget about the 1970s and 80s when we went to medical school. Things were a lot different. And so that was my absolute inspiration at the end of the day, that I can do something about it. Okay. So,
And you went on and founded the Continental Hospitals in 2013, which
yeah,
now has grown into a multi specialty institution.
right.
So tell us, what was exactly your vision? I mean, we did get some glimpse of it, what you really wanted to do. But if you can just elaborate on that, what was your vision and how has Continental Hospitals reached where it is today?
Right. Now, Kalpana, I think that's a wonderful question that I have said in several of my interviews in this last few years or several years, that the primary thing that India lacked, which I studied, my own personal study, was healthcare infrastructure. I think the problem with the country was, hey, your healthcare infrastructure is very appropriate. And then, the aspects of human resource, when you're referring to skilled nurses, skilled paramedical staff, and then, bringing ethicism into the profession, because like many times in life it happens, We believe we are doing good, but sometimes we may not be watching our back. So this was a time when medical profession was being kind of, the general citizenry of the country. They were losing faith, they were losing trust. Doctors were not being held in the same esteem as it was when I went to medical school. And when we see all of these things around, I said there has to be a proper solution. So, with my visitation to different parts of India at that point in time in 2008, 9, 10, and 11 to understand what is ailing this industry, that was a remarkable adventure, and I was able to gather, good information, which helped me to design uh, the future of Continental. If I was going to do it, we're not going to compromise any of these things. So, which is creating a world-class infrastructure from
Mhm.
the standpoint of great patient outcomes. The reason why we emphasize infrastructure is that it's extraordinarily important in healthcare. Probably there's no other industry that I feel where infrastructure matters so much
Yeah,
than in the healthcare industry.
absolutely.
Because everything here, from the get go of a patient being dropped at the front doors of the hospital, how the patient is shepherded through, and from wheelchairs to stretchers to the lifts, and the number of people around the patient, where they are really stationed,
Mhm.
and how long the patient is made to wait, when the doctor is saying, and then where the patient is being taken for diagnostics or imaging studies. If the patient is getting admitted, going to the emergency room, I mean, look at the number of verticals that we have. And each one of these areas, they have their own requirements,
Yeah.
whether from air circulation down to ventilation, down to other aesthetics and antimicrobial type of facilities.
Mhm.
So that is all a component of good healthcare infrastructure, which has a significant bearing on the outcomes of patient care. And then
Mhm.
choosing the doctor
Yeah.
is was extremely important.
Mhm.
I was truly not looking for all the great doctors, that India had who
Yeah.
were doing extraordinarily well. I wanted doctors because healthcare was going through a transition. Okay, there's completely a new breed of doctors for a new change of medicine.
Yeah.
What I went to medical school was different when I started doing residency,
Yeah.
when I started practicing, when I returned to India. So every decade there has been epochal changes. People
Mhm.
may not perceive it. Maybe simply the same antibiotic for urinary tract infection or same EKG that you're taking. Generally we all understand that. But it's
Yeah.
medicine. Medicine has advanced far beyond that.
Mm.
So these changes have happened so dramatically. And with time, these changes are happening at much faster pace. So I wanted doctors for tomorrow. Doctors who are trained in the modern day technology, understanding the new guiding principles of practice of medicine, will adapt to the future very well. So
Yeah.
one of the biggest things for me was digital healthcare.
Mhm.
When Continental started, I said we're going to have electronic medical records. Okay, we will
Mhm.
not provide any paper, any chart. The business of writing in one sentence where nobody can read.
Yeah.
Okay. The patient has to come back with bag full of chits and papers.
Yeah.
You know, I said, we're not going to practice like this. We're
Mhm.
going to believe in transparency at every level. So
Mhm.
how can doctors be transparent? You enter digitally into the systems, your
Right.
patient record.
Mhm.
So we are the only hospital actually. I'm very proud. Other hospitals tried.
Mhm.
I'm not going to say that in almost for a decade. They struggled to implement this, but unfortunately, when I spoke with them, they had significant problems to convince the doctors. So even that I had to see, hey, what is the formula I have to use without really upsetting the doctors. So
Mm-hmm.
one of the good tools was get younger doctors who have been trained in the digital era. They will
Mm-hmm.
adapt to the technologies much faster.
Right.
Number two, don't give them a choice. Hey, listen, I don't have paper. You can't write on your palms. I said, you have a keyboard and a computer. And if you can't use the keyboard, I'll provide assistance. That's what I did. A form of physician assistance to them. They'll be a keyboard for some time until you choose to learn. So I think it worked very well because when I said ethical practice of medicine and practice with integrity requires transparency. In healthcare as an industry, transparency at every level is extraordinarily important. And
Mm-hmm.
that can only happen through, 100% digitization. So
Mm-hmm.
typically in India, unlike in the US, people start outpatient clinics, then they're building, then they start an emergency room.
Yeah.
Okay, then they start one ward.
Uh-huh.
The reason is if a patient is coming to a hospital, if you do not have all the services,
True.
my goodness, what are you going to do in an emergency? If you
Absolutely.
don't have a cardiologist and a cath lab, are you going to send a patient to some other hospital by which time you may have a massive heart attack and die on the way in the ambulance?
Yeah.
So I said, no, we will start when we are ready for all of these things. So patients will not return when they touch the doors of Continental Hospital. Okay.
Mm-hmm.
And we started with 20 specialties, and today we grew into 50 specialties, or 50 plus specialties at Continental.
Mm-hmm.
And the growth was, painstaking, but deliberate, uh, very, very structured. And where we are today, we are very happy that we are provide these services to the communities at large and also to our international patients, also people from across India. And,
Mm-hmm.
we're glad about that.
Mm-hmm.
Yeah.
Lovely. Doctor, you've been quite vocal about, these ethical lapses in the healthcare space. So, can you share a few concerns that really bother you even today?
The major ethical lapses is not being transparent to the patients in terms of your pricing. Okay,
Mhm.
okay. What is something that costs? Okay. The second thing is doing things which are not necessary. Okay. Now it may not be right all the time because sometimes patients are also unnecessarily create problems. The
Mhm.
doctor is overdoing and whatnot. They may not be right because they may not understand the depth of the problem.
Yeah.
But in general, in a free market enterprise where India is private healthcare is 75%, the human nature is obviously when there's a reward system built in, if you do more, you get more, correct? That
Yes.
temptation is very difficult to curb. So, unfortunate problem is one of the ethical dilemmas is that doing more to the patients for earning more for an economic advantage. Okay. Number three is that rushing to see patients so that you are only focusing on quantum than quality.
Yeah.
Quality should trump quantum, correct? At the end of the day, to as I say, between value and price. Okay, you get the value for the price that you pay, not the other way around. Okay,
Right.
so I firmly believe in that. I said to my doctors from day one, please do not shortchange. Okay, these are the statistics internationally. An internal medicine doctor in 8-hour shift is expected to see 20 patients according to the American Medical Association. When I was in the system for 4 decades, I was able to take these stories, okay,
Mhm.
and vocalize to the doctors, by sharing them. Hey, we're not creating anything new, but this is how good places practice,
Yeah.
and this is how you spread your time in that 8-hour day. This is the time you take for a new patient. This is the time you take a follow-up patient. So the bottom line is rushing to see patients or somebody. Sometimes doctors take this great pride. I see 50 patients. Oh, my clinic is 100 patients today. Oh,
Yeah.
I do about 10 knee replacements every day. Okay. And I see 100 patients. There are many stories like this. Now, let me just give you this example. Somebody who says, I do 10 knee replacements and I see 100 patients. Just imagine for your knee patient who comes in with an MRI, you calculate in 2 minutes, even if you see an MRI, and 1 minute you spend that patient, where is the time for you? 3 times 100 is 300 minutes, and your 10 knee replacement is X hours, is
Mhm.
humanly impossible.
Yes.
But there are many doctors. There are many doctors who, because sometimes it may not be the doctor's fault, it could be the public's fault because they
Mhm.
only want X doctor, Y doctor. They don't mind being, they're not under, they just go by, well, he's a famous doctor and that is enough and all that stuff. So that's another thing is that, don't build up your careers based on uh, the greed of volumes.
Mhm.
Okay. If you're capable, what I mean to say is that if you're endowed with the ability that you can see this many number of patients, then extend your hours.
Yeah.
Don't cram things, 8-hour shift.
Mhm.
And then you're running to another place to see another 20 patients, another place to see another 20 patients. That won't
Yeah.
work like that. In
Really.
America, what we do, if you're a busy doctor, we start our days at 5, 6 o'clock in the morning. And if you want to work till midnight, you know, hey, it's your prerogative. If
Mhm.
you choose that lifestyle, it's up to you. We
Mhm.
didn't give quotas to the doctors. You
Mhm.
have to do, this many procedures, this many surgeries. We didn't really kind of force them. That
Mhm.
is the true, what do you call, it was a true cornerstone of Continental at the time when we were recruiting doctors. And after 13 years of a journey, still everyone knows about this hospital. The doctors are not given quotas or
Mhm.
doctors are not pushed to see X number of patients. Yes.
That's quite a trusted system that you've built on. And
Yes.
Dr. Reddy, it's very, I mean, something that I really often wonder about. I mean, you've seen so many patients. There must be some unforgettable cases for you, where maybe a rare diagnosis or some sort of a breakthrough or something that, stayed with you over the years. Would you like to share something with us?
Yeah. It's in a doctor's journey, there will be so many.
I'm sure.
And we are so besieged, with an emotional, sometimes trauma, sometimes, this deep empathy. And sometimes when you miss a diagnosis, the guilt of that could be so overpowering for the good doctors. Okay. So recently, I'll tell you, this is a true story.
Mhm.
Just exactly 4 to 5 weeks ago,
Okay.
I was in the US. This patient is a white American patient and basically came to see me because his wife was the office manager of a doctor. And they all know in America, Dr. Reddy is not there. He only comes in certain times. And so he came to my office and he was well built. And he said, Dr. Reddy, I'm just losing my muscle mass. So I started going to the gym
Mhm.
and then started taking, this protein powders.
Okay.
Okay. Then I asked, what is, how's your appetite? Recently I've been slightly feeling full, but otherwise I'm eating okay. Then he said he was having pain in the back, upper back, in
Okay.
between your shoulder blades. That's the only thing he complained of. He
Mhm.
said, I've been getting this little intermittent pain and I've been taking, the Tylenol there, which is equivalent to Crocin or Dolo here in
Mhm.
India. I've been taking some Crocin and Dolo. Then he said he went and saw a surgeon who wanted to do anti-reflux surgery. This is the surgery that we do when somebody is having heartburn, indigestion. Okay.
Mhm.
And then I asked the patient, hey, did you have any upper endoscopy? Did anybody take a look in the your esophagus and the stomach? Or he said no. But how did the surgeon tell you that he wants to do the surgery?
Yeah.
Well, he was not aware. The patient was innocent, so a lay person. And so there are bad doctors in America too. Okay, please let me know. There are doctors anywhere in the world. Ultimately, it is who you are, your conscience that it doesn't matter which country and what race or ethnicity you belong to.
Mm.
So I was very surprised and shocked. And so I asked him, can you please allow me to do an upper endoscopy?
Mm-hmm.
And he said, Doc, I don't have any heartburn. I don't have any chest pain. Okay. And for about 3 or 4 minutes, I was looking into his eyes, he was looking at me. And sometimes, these signs are extremely important where we are judging whether a patient is trusting me. Okay. For a doctor patient relationship, the most important thing is that the
Trust.
patient has to first trust you.
Yeah.
So I said, he's an educated man. Why is he a little reluctant for a simple endoscopic procedure?
Mm-hmm.
He agreed. So I was going to be living in 2 days. I told him I'm very busy tomorrow, but I'll accommodate you. So he came in, had his endoscopy. You know what did he have?
What?
A large tumor in the esophagus,
Oh God.
the food pipe,
Oh
extending from distal half, means lower third, the entire esophagus was completely filled with tumor,
my
which
God.
was extending into the upper part of the stomach.
Oh gosh. Mm.
And I was devastated. Such a nice man, wonderful man. Okay, his wife was so wonderful. I said, I finished endoscopy, came out of the room. He was in recovery. 45 minutes later, I had to go and reveal this news. And I was so devastated.
Yeah.
And there are two parts to this story very quickly. So his wife was in the recovery room. We took her to a private room. When I talked to her, she was already tearing. And I know that his outcome and prognosis is very bad.
Yeah.
Esophageal cancer of this extent usually has a very poor prognosis.
Mm.
Okay. So anyhow, I did that. We did the biopsies on all these things. And then after that, I tried to reach his primary care doctor. He was at a wedding. And I have this one nature which I practice, which I try to teach the doctors here also. Always communicate with the doctor who has sent the patient to you. Always communicate with the family member. So, and plus, I was living, the following day. I send a detailed email to the doctor. She's our office manager. This is what he has. His biopsies will be coming next 3 days. So, after coming back to India, in touch with my office. I said the biopsies as expected came back as cancer. Then I was trying to arrange an appointment for him to see an oncologist, the cancer specialist.
Mhm.
All that was, well, it was done. Then I was scratching my head. Just imagine, Dr. Reddy, if you did not do this, if this patient a week later somebody else has done, now how bad you would have felt, or what would people have thought about you?
Yeah.
You missed the diagnosis.
Mm.
Okay. So here is a point. We doctors, our life's journey,
Mm.
our day's journey is sometimes so extraordinarily challenging.
Yeah.
So many factors come into the picture. It's not as easy as a public to say, hey, doctor missed the diagnosis. If you're not accepting to do the test, it's not my fault.
True.
Yes. Now, if tomorrow I could have easily said, well, I'd suggest it to Jim or John or Jack or Robert, whatever, but he didn't accept it.
Mm.
People won't buy it, or
Right.
he's making a story.
Mm.
So anyhow, the bottom line is this was one of those very, gut wrenching for a
Mm.
nice person. It's a death knell. He was probably going to retire in 5 or 6 years, and this is what has happened. Then another quick story.
Yeah.
This is about, very dear friend who was in Delhi, one of the famous hospitals, who migrated to America. Again, he was a professor in gastroenterology uh, at our institute at Baylor College of Medicine. And he retired and after retirement of 65, then he wanted to basically spend his time traveling the world and all of those things, correct? So, which he was doing. They were traveling to various parts of the world and all those things. Very healthy, wonderful person, great company and all that stuff. His two children have done very well, and they're doctors too. So just about 5 years after his retirement, and suddenly he had a vague pain in the abdomen. He was rushed to the hospital. He has an irregular heart rhythm. That was he rushed to the hospital because of the irregular heart rhythm. In the process of evaluation, he was identified to have pancreatic cancer.
Oh.
Okay. So here is a person who has dedicated his life, who has written books, chapters on that subject with no warning,
Yeah.
who is going to spend the next 30 years beautifully with his family and enjoying and traveling. And fine, this was diagnosed. Then we nurture hope. All of us, when it happens, there is always hope in life.
Yeah.
So, medicine is advancing, there is hope. So he went through the whatever needs to be done and all of those things, and chemotherapy, 4 months, 5 months, 6 months. There was some hope. Then that hope gets dashed with a recurrence. Then another round of this, and finally, he succumbed to the disease. Okay, and this is another thing when disease affects you without warning.
Yeah.
Nothing can be so devastating and cruel in this world. I can understand something comes with warnings, and if you neglect, that's your problem. You have done this to yourself.
Right.
Something does not have a clear warning or clear symptoms, a nice life of yours, just dealt with this blow.
Yeah.
So these are stories, and these kind of stories I see, Kalpana, almost every day or every other day at Continental of different patients, because in India it is very unfortunate for various reasons, either not having access to care or spiritualizing of karma, everything else, God will get me better, and coming in late stages.
Yeah.
Because majority of our cancers in this country are diagnosed in stage 3 and stage 4. And then you expect something miracle to happen and treatment to happen for you to live, So the end all and be all of it is that, for good physicians who should have, significant empathy as a companion, okay, and who care for the patients, and who, to the extent of, you should be loving your patients because that's your passion, and that has really impact on our psyche almost on a daily basis,
I'm
daily
sure
basis. Yeah,
it,
yeah.
it's not easy being a doctor when someone's life is at stake and they're completely blindly trusting you, and you have to match up to that. And I'm sure, I mean, as you said, it's a daily occurrence in your life. So,
In fact, this year's 2025's theme for the Doctor's Day, which is coming up in the next few days,
yeah.
is behind the mask, caring for the caregiver. Okay? Which is doctors have to be cared for.
Right.
Doctors have to be treated well. Doctors have a life. Doctors have. It's very nice, the theme, actually.
Absolutely.
Many times we forget who we are, in the business of serving patients. But I
Yes.
think even doctors need compassion, doctors need support, doctors need hand holding,
Absolutely.
Yeah, so there's a very nice theme for this year's Doctors' Day thing, what they have coined, and whoever has done that, I don't know, but
Yeah.
that, that's the theme for the 2025 Doctors' Day. Yeah.
Which takes me to my next question. What a typical day in Dr. Reddy's life look like?
So literally in my life is very unfortunate. I did not have much time when my children were growing.
Mm.
And that was the biggest disservice, and which I recommend to people now for a long time. Don't ever do that. And I was too engrossed in my profession. I put patients first and family second. And very interestingly, when I used to interview doctors when hiring, and they always used to say, "My family comes first for patients." That nothing defays me because you need to have conviction in yourself, you need to have courage, you need to stay the course, and you need to basically walk the talk. And exactly that's what I did. And it took a lot of time. So my day begins in the morning now, where I work out for an hour, usually at 7 o'clock. I wish to start at 5 like America because nobody comes here to work. And especially in a place like Hyderabad, I think still the Nawabi culture is still there, I think. So I had to compromise by, when I used to be at 6 o'clock in the hospitals there, I had to come a little later here. So I work out 7 to 8, and then I get ready. I'm in my car, and I'm doing all my messages or whatever I need to do, and come. Then we have a teaching program. In my specialty, we have 14 specialties. We have residents and teaching program. So I start off with the procedures with the residents, the first hour or two. Then I see patients, and most of the times I finish my patients. I don't see beyond the first half of the day,
Okay.
and after that, I'm immersed in various academic activities, and I interact with the people with different.
Mm.
Because
I
often,
can
when
feel that
by
out.
the time I'm the evening, I am many days I'm in touch with the US, and
Mm-hmm.
I'm on the boards there and all of those things. So it becomes again a midnight journey for me by the time I retire, and the
Mm.
next day starts again. So I think is this is the way I feel, Kalpana, correct? If you're enjoying something,
That's true.
okay,
Yeah.
and that itself brings you tremendous happiness, and you don't mind it.
Mm. You just spoke about academics and how you're teaching the next generation. So when you're mentoring these young doctors, what traits or qualities do you see in today's generation that kind of surprise you or make you happy, or some message that you would like to pass on?
Yeah, there's a generational shift, okay, and we don't have to kind of have a discourse on that. And I love all the labelings of Generation X, Y, Z, G, all that
Yes.
stuff. Okay, and I could imagine my own children to be in that generation. They perfectly emulate these qualities. Okay, so today's generation is in a rush. They want a quick fix. They want everything to happen at a pace that they are oblivious to the fact that it takes time and investment and effort,
Yeah.
to be there. So urgency, quickness of things, and not grasping with the reality of situations is one of the issues that we see in the current generation.
Hmm.
The positive side, they're very smart.
Yeah.
They are the generation which have become technologically so adept, and they'll be the ones who are the future of any country at the end of the day.
Right.
When I sit next to my daughter or my sons, if I'm having my laptop or my phone with me, they teach me. I just ask them because every time I take that advantage, they show me so many shortcuts and they're so quick. When I tell them, "Can you be a little slow teaching me?" Yeah, Dad, you won't get it. Don't worry. I said, "Listen, they're impatient. They're so impatient." We never told our fathers or our mothers like that. If they need help, we patiently sat and helped them, and they don't have that, you know. And they're selfish. They are very selfish. They look into themselves, and their immediate family, So, and which is true story. Everybody exchanges. So when come to the medical profession,
Mm.
what I see today's doctors is the huge difference when I was a medical student. Okay, often we don't see that level of energy or or commitment. Now, I can't generalize this. There is exception to the rule, but in general, I would say that. Okay.
Mhm.
Then the other issue is that are you choosing a profession because of monetary value
Right.
that you're going to make money and all of those things, which seems to be one of those significant factors. But at the same token, we continue to see doctors or students like what I grew up with in that era, whatnot, very passionate, very hardworking, committed, and want to be the best and goal oriented and want to be researchers,
Mhm.
So be committed,
Mm.
okay, and be patient. There is no shortcut to greatness if you want to become that great human being. You have to put in your hours. You have to learn the right way. You continue to embrace the tenets of, or the principles of good practice of medicine at every stage of your life and be a person of the highest integrity.
I really do hope every aspiring doctor listens to what you just said because that's exactly the kind of doctors we need in future.
Absolutely, especially in a country like ours.
So, after all these years of achievements, I mean, what is it? What is that one thing that truly brings you joy? It could be anything, your personal or professional.
Yeah, at this stage of my career, what brings me joy is what was bringing joy to me all these decades, which is patient satisfaction and patient outcomes. I am very sensitive. I'm very short fused. Okay. That's only negative in me of when somebody asks me, when do you really get irritated or angry? Is when I see that if a patient is not properly taken care of. I have no tolerance, no matter who it is, when it is, what it is. My joy is that our staff, I don't consider them employees. In my heart, I always treat them, they are stakeholders, shareholders, they
Mhm.
are partners, they are, without them, nothing will happen. Correct?
Yeah.
So, especially in healthcare, healthcare is we all know that it is so multi-pronged. Probably there's a very few professions, have where the need of service from so many contributors has to come together and gel well. So I truly value, the staff, and we are constantly in a training mode. Be strong and courageous.
Right.
Stand up to your stand up to your leaders.
Mm.
Stand up to your hierarchy.
Right.
Express, communicate. Okay,
Mhm.
let them understand that this is how you feel and this is your opinion. Don't keep it in your heart and sulk and
Yeah.
say that yes, you can do it. Okay,
Mhm.
this has been my mission.
That's very inspiring, and I would like to now lighten up the conversation a bit, and
Yeah.
let's go to a quick rapid fire. So,
Okay.
are you
Well,
ready?
I'm ready. I think whatever comes to my heart. Yeah. If I make the mistakes, please pardon me. So.
So, doctor, tell me a book that deeply influenced you.
Okay, it's Off Human Bondage by Somerset Maugham. The only book that I read and cried, and I
Oh,
was in my first year medical school. I recommend to every doctor to read this book. It's,
lovely. Then your walks or workouts, what would you prefer?
I prefer workouts,
Tea or coffee?
coffee.
And what keeps you up at night? Apart from your patients, your work that we know now.
Yes, is a project that is coming up, a fear that whether it will happen on time or not. Yeah,
So, and one thing that you are still curious to learn.
I'm curious to learn human relations
Oh, lovely.
every day, every hour, every minute.
Hmm.
Right? It's more than a quantum computer learning human relations.
Absolutely, I'm sure. And before we end this conversation, I would like to understand from you, how do you see the future of healthcare in India? Where is it heading?
Right. Future of healthcare, as I've been recently telling for the last few years, is fantastic. We are truly at an inflection point where India's is is slowly kind of gathering that steam, positioning itself. We can respect what happens here in healthcare. When I now compare to what is happening in developing nations, particularly America, which I find sometimes, very unfortunate or sad story, which many of my peers and colleagues are also feeling there. We are in such a wonderful position because we always talk about, access to care in India, but our access to care is absolutely fantastic. You can go to a Galiwala doctor, you can go to a public hospital, you can go to a GP, you can go to a hospital like Continental, even a lower middle class can come and access care. So access to care is phenomenal. Now, when you talk about rural urban divide and all of those things, yes, these are all issues that have been there for a long time, but I see many bright spots.
Yeah.
And with the advent of artificial intelligence, which is going to bridge this gap, and we are one of the early adapters of this. What
Mhm.
is, I
Yeah.
think, sooner than later, probably less than a decade, we probably will dominate in the world in
Mhm.
terms of incorporating AI into all forms of healthcare services. So
Yeah.
basically, we'll become one of the revered digital global healthcare platform where the world will come to see us and
Mhm.
appreciate and learn from us. You know, the
Mhm.
most beautiful point, Kalpana, we deliver care, the same care in the Western world at literally one tenth or less than of that cost. Same machines, same technology, similar doctors, same skill sets.
Mhm.
If we can do that and we are doing it,
Yeah.
you know, this is a great future that I see.
Mhm.
And thanks to the Prime Minister and the Health Minister of this country for the last 15 years, we have seen they've increased the number of medical graduates,
Right.
doubled them. They
Yes.
have they have doubled the postgraduates at the end of the day. So what this is doing in a city like Hyderabad, when I left India, there
Mhm.
were hardly 6 or 7 postgraduate seats in gastroenterology.
Mhm.
Literally, I'm talking about 1983.
Mhm.
Okay? Today, the city of Hyderabad alone produces 40 gastroenterologists.
Wow.
Continental alone produces 6 of them.
That's.
Just imagine
Hmm.
one city.
Yeah.
So we will meet the WHO requirements of the ratio of doctors to patients. We are improving in technologies. We are building better infrastructure. We are getting gradually affordable as the nation's GDP improves, disposable income improves.
Mhm.
Okay. So if you fast forward the clock, in 2047, we want to emerge as developed nation.
Mhm.
We are there. Along with the developed nation, India's healthcare will be robust. See, today we are in the top 10 or top 5 of medical tourism destination, correct?
Right.
And people are coming here is not just merely because of the cost factor,
Right.
because because of the trust factor.
Hmm.
Yeah,
Absolutely.
yeah. They are getting what they were getting in the Western countries.
Hmm.
India isn't to that spot. So, in a nutshell, great future for healthcare.
Great. On this brilliant note, thank you so much, Dr. Reddy, for joining us. And it was a lovely conversation. And I hope aspiring doctors, practicing doctors, and everybody hear what you have to say. And it's very, very inspiring. Thank you so much for joining us.
Thank you, Kalpana. Wonderful. I think look forward to hearing this and look forward to more of your programs and wish you a great success. Thank you.
Thank you. Thank
Bye.
you.